Welcome to the Depth Perception Podcast.
We go in depth about the perception and misconceptions of optometry,
which include the business of optometry,
social issues within optometry,
and life as an optometry student.
Coming straight from Dr. Jasdeep Singh Soni,
Dr. Nadia Afghami,
Dr. Douglas Akiti,
and Dr. Svetlana Nunez. We hope you enjoy this episode.
Here we are. We are back with another episode. Today we're missing one guest, guys, so it's going to be kind of weird, but shout outs to Svet. Hopefully you feel better. She's under the weather tonight. Everyone say hi in the comments below. Today we're talking about the future. We're getting our crystal ball. We're getting it all together. Let's talk about optometry in the future. What do you see in optometry in 10 years, guys? Nadia, you start.
Yeah, 10 years. So 2036.
Mm-hmm.
Well, to go forward, we should go back, right? So let's imagine what optometry was like 10 years ago, right? So let's go back in time. I can't math, guys. What's the math here?
That's 2015.
2015.
What were you all doing in 2015?
Yeah. So imagine go to your optometrist in 2015. I think, manual 4-opters, right? We were definitely using that. A lot of people probably using paper charts, I'm going to think,
paper
right?
charts.
A lot of, we weren't really using like EHR as widely, I'm guessing. I mean, I wasn't working, but yeah. I'm trying to think, because when I worked at the plastic surgeon's office, what it was like, right? Like, we did have some computer technology, obviously, for that. Probably maybe not as in-depth as we have now. But yeah, it was a lot of paper charts, and I have to pull charts and things like that. As far as optometry, I think that the technology has advanced. Don't quote me on this, but how long has digital retinal imaging been around, right? Or as widely available to us, and the technology on our OCTs and all that stuff that's changed, right? So I think in the last 10 years, we've advanced so much that we can only go up from here, right? So probably in the next 10 years, hopefully we'll have AI scribes on every EHR. I know some have that now. I know we're kind of using that now with Barty, which is cool because I'll just push the button and then I just have a conversation with them like, hey, what brings you in today? Oh, you don't like your glasses, blah, blah, blah. And then it will listen to what I'm saying. And then it writes me a summary based on what we talked about, which is really cool, right? And then I just push a button now and I can be like, OD had scar inferior at 5:00. And it types it in for me in the right box and everything. So I think we're going to have a lot more EHRs like that for sure. Because we're going to be pretty AI driven. Hopefully the refraction gets easier. It's pretty easy now, but I think everybody should have standard of care that's retinal imaging. I think that should be definitely a standard of care in the future for optometry in 10 years. Those are some of my thoughts. JD, I won't take all the thoughts.
Those are great thoughts. No, keep listening. Just to add on to what you're saying, 10 years ago, there was no MySight in clinic. There was maybe not XR, Biofinity XR, or, I know these new companies, they're making toric contacts or maybe multifocal contacts will expand. I think everything's just going to expand. You're right about the retinal photo. I was looking back at one 10 years ago and they barely didn't even get in the periphery in the one in our clinic. And now, wow, you see a ton of periphery. Maybe it can get even farther. I don't know. So
that's true.
Yeah, those would be good changes with the just on a day-to-day basis, even the autophoropter, right? So like you were saying, I having the non-manual one. Very much easy on the ergonomics. That's really cool that you have the AI stuff, though.
Those shoulders.
Yeah.
Yeah, I think, I've been in optometry actually a long time. I started working at LensCrafters in 2011, while I was in undergrad. Yeah, I actually think that they've been ahead of the curve in terms of doing things very techy, and I think that they had autophoropters at that time, I think in 2015. Even on the glasses side, they had this thing where they put this these little green balls, this little thing on top of the frames, and then you take a picture and then it does the measurements automatically.
They still do that. I think we had that.
Which is interesting. But I think now they do it with the iPad now instead of sitting down, right? So yeah, it's very cool to see what has progressed in 10 years, but also it's crazy to think about what's progressed in the last 2 to 3 years, right? With AI being added in the past, 5 years or so, it's really just sped up like crazy with the fact that it's being implemented into everything that we do now. Are there some things that you guys do, even if it's not in optometry, or let's start first in optometry? Do you guys do anything with AI? Like, do you incorporate that? I know, Nadia, you just mentioned your AI scribe through your EHR now, but anything else that you utilize, like, ChatGPT or Google Gemini, all these things?
Yeah, I make all my forms on chat.
Like, what kind
Recently,
of forms?
we started doing like myopia management, and you just write me a consent form for myopia management, right? And it does everything for you. It
Mm,
like patient educates, like it just is so fast. Like, so it just makes it like a lot easier. Or like if I honestly, I'll use chat sometimes if I like am confused and I can't find my will's eye. Like recently I was like, okay, God, I can't remember the cross reactivity between like penicillin, doxycycline, all this stuff. And so I like put it in a chat, and it like helped me like narrow down, because I had an idea of what I wanted to prescribe, but I just, I wanted to make sure that it was the right thing. So I thought that was helpful. And I think in the future, we'll probably have something where we like type in like our diagnosis, and then it'll tell us like possible treatments for us, and things like that, which is like, then it's like, is AI taking over our jobs, right? So on the flip side,
JD, do you utilize the AI every day in optometry first, and then let's go to personal life after?
Not necessarily too much on a day-to-day basis inside clinic, but definitely personal life or even some consulting opportunities. Like I think Nadia's note taker thing. Like I love Otter AI. Basically, on our meetings, it'll record the meeting and then give notes, and it gives you feedback and action items for anytime you have a meeting, and that's so helpful. With I can send summaries to people. I know what homework I have to do when I have tasks, when I have meetings. So the AI and the note takers, that is very, very clutch and helpful from a standpoint of responding to emails professionally. I think ChatGPT is really a game changer, whether it's patients or work related content. So that's been helpful. What do you guys think? Okay, so we talked about like where it's going, right, or where it's been, and like how it can affect us. But what do you think? Like, what are some changes that it could actually implement in the future, right? Not just like building upon the past. Like, for example, I believe we were talking about staffing, right? But do we think there's going to be a check-in person from now on, or do you think that you're going to just check in on a computer now, like some of these places at like Starbucks or other places that have that, right? Like, how do you think it's
Right.
going to affect staffing, or where do you think it's actually going to change in 10 years from now?
So I think that the best way that it'll be utilized within optometry is implementing it into the tools that we use now, like OCT, like retinal photos. They're already starting to utilize AI like right now in terms of checking like biomarkers and bios, like it's very specific, like detailed things that we can't see or do ourselves, to be able to see if people would like have more chances or are more likely to have certain diseases. So I think AI will be able to help us determine like these things way sooner. And if we use that the right way, obviously that can help people before, let's say, for example, for glaucoma, before optic nerve damage starts to occur way past the cellular level, just based on these patterns that AI is able to utilize and recognize. In terms of staffing, I think, I think things are going to get towards that. Like we're already utilizing, places where the doctor's not in the office, right? I forgot what's that called? Like
telehealth.
telehealth, right? Telehealth. So we're already utilizing that. So now it's just going to keep progressing. The doctor's not going to be there. Maybe now there's no front desk person. McDonald's utilizes that now, right? Like I don't even like you go and just touch screen and make your order. Like you don't even talk to anyone. It's kind of crazy. And it's definitely,
Yeah.
everything is just going to head towards that, I feel like.
Yeah, less communication in person, right? Like I feel like a lot more online bookings. Like we're gonna switch to like an online booking system now, so they don't even have to call us. I think like insurance. What I would like to see is like a lot more collaboration between professions, and hopefully like in the future things like AI and the tech there can help us do that. Like how cool would it be if I could see a patient's blood work from their doctor just with any EHR, right? Just to have something that you can just take care of the patient comprehensively without just having these little parts, right? Like recently my patient came back and he's like, hey, yeah, I just wanted to let you know, like, he was there for like a contact follow-up. And then he's like, yeah, a couple of days ago I was in the hospital and like I had like a clogged artery, blah, blah, blah. And I was like, it would really make me feel a lot better if we just took a photo. And like, I was like, he didn't want to be dilated. It was like, at least, we can at least do a photo. Like I can just take a look. But if I had known that too before he came in, I could have been like, hey, we're probably going to die at this visit. I just want to take a peek, you know? So, like, in the future, it would be cool to see a lot of collaboration between professions, right? Like, it's like, you know, some patients have HLA-B27 and we never hear about it because they don't think it's important for optometry and this and that. But if we had something that was like an AI thing that like filled out the chart for us and we could like have that, because patients are never the best historians. So I'd like to see something like that maybe in the future of optometry.
Like they put in like a chip before they.
Yeah. Or like you have
Okay.
like a card, you know, it has all your like stuff in there. Like imagine you come in and they're like, just tap your card, and you tap it and it's like all your EHR records and it has like your insurances already on there. There's no like guessing. It's not like, oh, let me see if you have VSP. Oh, let me see if you have IMED, you know, like everything's just on the chip.
And then we can add stuff to the chip. Like, okay, you need preservative-free tears. This will send to your chip so you can go buy it. Or
Yeah. Wouldn't that
what
be
else is
cool?
sent to the chip? All the results or whatever.
God forbid. The chip? You talking about the implantable chip? No.
No, like a
No, I'm not
card.
doing it.
Wow, I didn't say the implant.
Keep that on my phone.
And I got excited when you said tap. Like,
Right.
No,
You talking
well,
about
maybe
tap your
like,
wrist?
no, I mean like a tapped card. Like you have like just like a card that's like comprehensive to like all your medical records, right? And it's just like you just tap it and it just everything comes up. Like
Honestly, yeah.
everything you're allergic to. You know, I have a like my patient who's allergic to everything. She's just an old lady, like she doesn't know. But, you know, I'm like, she's like, these are the meds I've taken, and I'm like going through them, you know, through her, on her phone.
On her papers.
Yeah. So how it would be so cool if I was just like tap and it was like patient allergic to this, right? Like has had reaction. This is what the reaction was. Like, you know, do the pros outweigh the cons kind of thing. And then you just decide. It would help us so much, like taking care of patients more like comprehensively. Just would really like to see that.
I mean, that's a great idea. And that's, I think, something that I think healthcare has been striving for. A lot of our schools had the interprofessional like programs, right? Or the classes where you collaborate with all the different professions. What do you think that it would take for it to get to that level? Like, what do we need? Like healthcare, like how do we get to that? JD, do you have an answer?
I guess my simple thought for why does change happen? Money has to be behind it, right? So would patients pay a higher premium or hire something to get this sort of intercollaborated healthcare? So like I think Mayo Clinic, for example, these patients are really well off, and I did a rotation there, and so they're paying higher higher insurances or higher premiums or whatever it may be to get into to see these doctors, to be in a clinic that's integrated like that. So my answer would be there has to be some sort of money incentive behind to spur this kind of change for other clinics.
So you feel like they already have this kind of thing there, but they're paying higher premiums to be able to get that access?
I think people who are more well off are having some of these benefits. Yeah.
What you,
I think
Nadia, what do you think?
we need a lot of government changes. Change doesn't happen unless it happens with us, right? Like think of like just in general the strive of optometry in the last 10 years, just legislatively, you know, like the scope of practice is expanding so quickly, like, and that's not from nothing. Like that's a lot of our like packs and stuff like doing work for us, right? So our national societies, the AOA, like all these things that we kind of put on the back burner in our mind, but they're really like fighting for us every day, right? There's people that are passionate about this. And I think if we just like implemented the change, we really have to like work with other AOAs. I mean, like associations, I guess, equivalent AOAs, right? Like to like make things work, because everybody has to see the value in it before we can like make it happen, right? And then we have to convince people like the government that we need it. Because didn't they say like by a certain year we all have to do like no more paper charts? I think that's a thing that's supposed to like be implemented or something like that.
It hasn't been implemented. Let's put it that way.
Yeah. But now I love where you're going with this, because, you know, I think now more than ever, it's super important for us to be knowledgeable and just be a part of like the legislation talks, as it has to do with us being able to affect or be involved with government issues and situations. I'm sure you guys have heard about like the whole nurses are not a profession, like are not professionals, and they're not considered a professional degree anymore if you're going for the master's or the doctorate. Did you guys hear about this?
Yeah, it's like PA. It's like a bunch of them.
PA involved too? No, PAs, accountants, architects, things like that. They're pretty much taking away the plus loan that you can get, the graduate plus loan. So they'll have to get it by any other means. And, you know, that's if this could happen to us too. We're already forgotten about in when they talk about healthcare professionals. They say MDs, they say dentists, and they always leave us at the end. So it's very important for us to, stay in tune and be really on our stuff when it comes to legislation and pushing for it.
Nadia's going to talk about how we don't get mentioned by scrub companies now. So I'll let her.
She had to advocate for that, and that's real. Like, that's
I
crazy.
did. I remember I wrote Joanne Fabrics and I was like, optometry's not on the list of people that get a discount. It's healthcare workers.
It's such a Nadia thing.
And then they changed it. So you're welcome. I know.
Thank you.
Yeah. So now you can shop at Joanne's.
Appreciate
10%
you.
off.
What do they sell there?
Crafts, arts and crafts, my friend.
Get us on the list for Michael's too.
Okay, I'm on it.
The future is happening.
What
JD,
about,
what you got
sorry,
on
let
that
me
one?
ask real quick. Okay. What about like the future of like treatments? Like what do you think we're on the close of like not curing, but like treating better in the next like 10 years in optometry?
What specifically?
Yeah, like what diseases are we like really putting the research towards? I'll start. So, they're doing all the light therapy now for like AMD and stuff, which is pretty cool. So they're getting pretty close to that, I think.
And first thing that comes to mind is the correlations to Alzheimer's with, I think, AMD as well, and just eye issues. So again, those biomarkers, I think the AI and all that is being utilized, and they're doing research to see how everything relates and how you can potentially stop or reverse, Alzheimer's before it happens.
Yeah. Or like dry eye. Like I think in the last 10 years, we've made like a big like leap forward in like how we treat it, and like all the new things that have come out, especially like JD mentioned, myopia management, right, has changed. We just recently got the new Stellus lenses even for kids. It's been FDA approved now. So, I mean, these are big things because some kids can't put in contacts and you can't just, they sometimes don't even put in their atropine, right? So now that they have to have glasses they can see through, right? So I think like disease is going to be big treatment wise more in the future, hopefully. I mean, you can't cure glaucoma. We can slow it down, but what if you could reverse it a little bit? I don't know,
I mean, one side note thing that just comes to mind when I'm thinking about the future is, how VR glasses and all that is being developed now and being pushed. So, virtual reality, augmented reality, all of these things are coming to fruition. And what you have to do, you have to be able to see. So like we are actually directly going to be more involved than others in terms of what's going on with the future, because people still need to see, they still need the prescriptions to be able to utilize these devices. So that's going to be cool to see like how those things get incorporated to optometry. Do you guys have any thoughts on that?
Yeah, I mean, I agree. I think that the meta glasses have made big leaps in the last couple of years for sure, right? And the technology is just ever changing. Remember, I had Snapchat glasses. I never used them because they only did one thing, right? But now we can do all these things. Like, maybe in the future it can check your IOPs, or I think somebody actually at the conference was mentioning that, like, there might be new ways to check your eye health through the glasses, like maybe your blood pressure even. Yeah, I think the future of like wearable tech is big, and I think glasses are one of them because we need those to see. What about you, JD? I liked that you said about the contacts earlier, because I agree. I think in the last 10 years, like contact lenses specifically have like grown a lot.
They have. It's nice to have more options, and these contact lens companies are expanding, and they're finding solutions that we need for our patients out there. So yeah, it's intriguing to see. Hopefully they don't come out with like 3-month lenses, but more day-to-day solutions that can be very helpful.
Yeah. Do you think we're going to have wearable contact lenses like tech?
Absolutely. 100%. Yes, I do think that. They've been doing research on that for like 10 years. So I've seen that. Also implantable lenses. I mean, they already do that now in terms of for low vision, implanting telescopes in and around the retina so that you can see. It looks pretty crazy on a
Toric colored contacts.
coloring. Like
They had, I
contacts.
think they're just expensive to make.
I know.
It's not like they can't make them. It's just
I know. No, I know they're.
Toric XR colors.
That's what I need. That's what I need. I need the XR.
Multifocal toric XR colors. Perfect. What about like the downfall of like what are the cons of like the future with like AI and stuff? Like, do you guys see any like downside to like AI?
I mean, if we're talking about like telemedicine, I think as optometry, we like bring customer service, we bring energy, we answer questions, we take time. I think that side of it could maybe potentially get overlooked based on how someone could potentially be doing it or not being in person. Or maybe if someone has a question, right? Like, hey, they call in, and instead of trying to get their question answered, every time I call in American Airlines, actually, I never like it's so hard to get my call in, right? I have to talk to like 5 machines to get a person to get my question answered. And maybe someone has a question like that. If our office is all controlled by AI, it might take more hurdles to get through. So customer service is something I could see potentially getting sacrificed.
What about
What do
you,
y'all
Doug?
think?
That's interesting. Trying to think now. I think what can be sacrificed. I think just like health in general. I think giving too much information, giving too much access to AI, like depending on how the AI is being incorporated, but giving too much access to AI, if it felt threatened, I feel like it could try to go against like human beings, which is like kind
Chat's
of a
my
darker
best
side
friend.
of it. Right. I be telling
What
chat
is
The
what
thank
do you
you.
want?
Terminator.
I say please and thank you all the time because I don't want to get turned on when it comes
Just
down
like
to it.
chat, I love you before I go to bed. Good night, chat.
Okay, real quick, I watched this YouTube video and it was about this. Like they did research to see what AI would do if you potentially like threaten to shut it down forever. And so in this scenario, they had access to emails and everything, right? So they sent like one of the bosses an email that like we're shutting the AI down at 5 p.m. tomorrow. So and then there were some other emails that like were fake, but it was like that same CEO, he's been having extramarital affairs. And so the AI, like, and they did this with like different AI models, like different companies. And like I think it was like 70% of the time, it tried to blackmail that guy, like, hey, I'm gonna tell the other board members and your wife if you proceed with shutting me down. Like AI will do, and they told it to not be unethical and to do all these things, but it'll still override that if it feels like it's being threatened. So that's the scary side of AI that people don't really think or know about, and that can threaten our existence in the future, to be real.
I don't know. I think it's going to be a long time before AI decides to take over. However, I'm more afraid that people will rely on AI so much that they stop trusting us as optometrists and start judging their like everything on what AI says more, which is kind of a downfall, right? Because everybody has ChatGPT now and everyone's like, oh, I could probably just give myself a prescription. Why am I coming to you? I could just ask chat, right?
Mhm.
So I see that becoming like a little bit more of a downfall, like the access to all the information. But it's like you have to have like critical thinking as a human versus
Mhm.
like the AI critical thinking, right? Because it's not always right. But
Right.
yeah, I just don't want
Exactly.
patients to come to me and be like, I really want this drug. And you're like, you're not like, you don't need that drug. And they've like convinced themselves because they've done their own research, right? How many times does that
Right.
happen when they come to you? Or like,
Right.
I remember a parent one time was like, I'm not going to get my kid these stronger glasses because it's going to make their vision worse. And I'm like, who told you that? And they're like, oh, I did research online. And I was like, no, you didn't. It's not, that's not how that works, you know? So, just having that kind of scenario in the future.
That is a difficult. Dr. Google is definitely difficult, and
What the fuck?
sometimes, yeah, too much knowledge is not helpful in that sense. It creates a lack of trust.
So there's good, the bad, and the AI. I guess we should wrap that up, huh, JD?
No, I think so. I think we brought some good thoughts about what has happened already in the last 10 years, what it could happen again in the next 10 years, some potential changes, good and bads, and we'll see what happens in the next 5 years. And then we could do another podcast about AI and what it's done for us.
Yeah, for sure. It's okay. Welcome back. We're wrapping up.
I got kicked out, guys. We're
You're
back.
good. You're good.
Okay.
AI, the good, the bad, and the AI. Maybe the AI heard you,
I
threatened
think
them, and they
so.
kicked you out.
I think that's what's going on.
It's
I'm sorry,
possible.
AI. No, I'm
Yeah.
your friend. We're
I
cool.
love you, chat.
Is there going to
And
be
on
like a
that
future
note,
AI religion?
yeah, maybe.
AI lights.
And on
AI.
that note, that's our pod.
Until next time, peace out, y'all.
Share with
Make
us
sure
what
I
you think is going to happen in optometry.
write in the comments what you think's gonna happen next. What do you see for the future? Like and subscribe. Follow us on all the channels, all the platforms. We appreciate y'all. Peace.
Bye. Hey guys, thanks for listening to the Depth Perception podcast. Don't forget to like and subscribe on all of our platforms, including
Spotify,
Instagram,
Google Podcasts,
Apple Podcast.
YouTube. Make sure you click that button. Double tap that.
So you guys have no reason not to follow us and tune in to the next episode.
Stop wasting time.
Get in depth.
Subscribe.